All right, joining me once again here on the Matthew Filipowicz Show is my friend Joan McCarter. Joan is, of course, a writer, a blogger, and the senior policy editor at Daily Kos, which you can find at dailykos.com. Joan, thank you so much for being on the show again.
It's great to be on.
All right, so Joan, recently there was a study released, a study from the state of Oregon on Medicaid. If people haven't heard about it, what exactly is in this study?
Right. It's a quite interesting study that they were able to do, looking at a specific population of people who had not had health insurance. Back in 2008, Oregon had some extra money. Not a ton of extra money, but some extra money to put into Medicaid. So they held essentially a lottery system. And 10,000 lucky people got to get health insurance through Medicaid. And something like 90,000, unfortunately, who applied did not. But this created a perfect study group of the people who got insurance versus the people who did not get insurance. So this study, results were just published in the New England Journal of Medicine, looked at these two populations and looked at a variety of indicators to see what difference getting Medicaid might have made in their lives. What it found from a physical health standpoint was not a lot, largely because the sample size for the study wasn't huge.
Right.
What they did find that was significant, statistically significant, in this group of people were much lower rates of depression, getting mental health treatment, and reports of much less income insecurity because they could actually afford health care. They didn't have to worry about the devastating costs of an illness because they had coverage. So what we found was that on some indicators, blood pressure, propensity for diabetes, blood sugar levels, not significant enough changes to be statistically significant in this small group.
So hold on. So they're saying that Medicaid didn't cure diabetes, it didn't cure high blood pressure, it didn't cure all these ailments that affect, millions of Americans, and because the right wing is like flipping out over this and saying how
obviously the right wing is using this as see this is why states shouldn't do Medicaid expansion. It doesn't make any difference.
I still that's unbelievable. So go on. I interrupted you there.
No, go ahead.
No. It's still just like it's just the logic of this criticism. It's just like, yeah, well, in 2 years in this small sample, it didn't. These people still have diabetes, so there. That just that logic to me is just like the dumbest argument I've ever heard. And yet, so many people are making it, and it looks like even some Democrats some of the Democrats who are very into doing all types of cuts and austerities and shredding the social safety net. It looks like some of them are trying to even grasp onto this as well, right?
Right. Of course.
Yeah.
And anything that they can grasp onto. And of course, that the right isn't going to actually talk about the problems with the study, talk about the limits of the study. It's not necessarily a problem with the study. It was, they had a limited number of people they could go in with anyway. So the small sample size isn't the fault of the study. It's not anybody's fault, but it's also not something that the right is going to talk about in terms of what makes for a valid scientific study. Of course, it's scientific. The right's not going to grasp science. Very frustrating to see this happen, particularly when we do know that there is real significance in the quality of life for people when they have health insurance. That we do know. That was a finding that they could say definitely happened because so many of these people said, yeah, my life's a lot better. So many people got mental health treatment. So many people reported less depression.
And like if a person does have diabetes or high cholesterol, what, we're just supposed to not allow them to go see a doctor? That is that
Right, absolutely. We cut them off from treatment. So when they end up getting horribly ill, they end up going to an emergency room and costing tens of thousands of dollars more than they would have just getting routine maintenance care, getting the kind of preventive services that they need to maintain their health. Yeah.
Yeah, I don't see what the big deal about this study is, and why. My brain is just not wrapping around why this study is ammo at all. Really,
it shouldn't be. It shouldn't be. But they're going to use whatever they can get their hands on.
Yeah. Yeah. Amazing. Actually, I wanted to ask you, because you also wrote recently about how Medicaid is being denied, at a bunch of different right-wing states, essentially. I mean, look, I'm someone who I'm not a gigantic fan of Obamacare. I'm very much a single payer.
Right.
Type of person, but there are definitely parts of Obamacare that, if were implemented, would actually be good. I mean, I was very much okay. Pre-existing conditions, getting rid of that, great. The Medicaid expansion was actually, oh wait, this is going to get millions more people health care,
right.
So I am very much for that. However, the way it was designed, and then with the Supreme Court ruling, it's looking like that's not looking that good as far as that goes. So let's talk a little about that.
Right, and in fact, today we just find out that Florida, the state that has is it Florida or Texas? One of the
I think
two.
Texas, and I think Florida's right there.
Yeah,
I think Texas is slightly ahead.
For who has the largest population of uninsured. So Florida is rejecting it. Interesting, Rick Scott did actually try to make it happen. I think that he probably was looking ahead to re-election and thought, if I'm going to be reelected statewide, I should probably get more people insurance. But much like the United States House of Representatives, the mostly Republican Florida legislature didn't have to worry about running statewide and only has to worry about running in their districts. So they're rejecting it. You're right. The Medicaid expansion was probably the most important part of Obamacare, I thought, for actually extending coverage to people, not just getting health insurance, but actually getting access to real health care for a critical group of people. Those who will sort of fall into a crack now between the lowest tier of what's going to be available on the health exchanges through subsidies and the people who are really down and out and qualify for Medicaid. There are a lot of single people, working people, who wouldn't have qualified for Medicaid otherwise, that could now finally through this program, which 26 states are not going to participate in. So, now one of the difficulties is figuring out how do you get these people in? How can, perhaps on the federal exchange, since a lot of these same states that rejected the Medicaid have also rejected actually setting up their own health exchange. So the federal government will be doing it for them. And it's going to be whether the feds can figure out some way to do a Medicaid-like option on their exchange, or how are we going to bring these people in? People that fall between the lowest subsidy level on the health insurance exchange and qualifying for Medicaid in their state. That's a tough one, and it's one that absolutely has to be done right for this to work.
So it's crazy. 26 states, over half of our states are saying no to Medicaid expansion. That is crazy.
Well, yeah, it astounded me. I really thought when it came down to it, the states were not going to be able to say, okay, we can't take this money. We can't refuse to take this money. And they are. Now, the good news on this is that there isn't a hard and fast deadline for taking it. States can reverse position and decide that they want to participate. So the 2014 election could help a lot in getting some of these states back on board. After 2016, the government doesn't provide 100% of the funding for this expansion anymore, but it drops to 90%, so they still pick up a really significant portion of it. So if it works really well in those states that do take it, some of which surround states that aren't, like where I'm at now, I live in Idaho now, and our legislature refused to do Medicaid expansion. but Oregon and Washington haven't. And it could be that people in Idaho look across the border and say, hey, they're getting good health coverage there. What's the deal? Maybe not likely in Idaho because it is Idaho, but still, there could be more political pressure building in these states to go ahead and do it.